Yeah, that'd be a little awkward.
5 o'clock, sorry. Okay, guys, let's call this meeting to order. No, you're not supposed to do that now. Is Carrie, hi Carrie. No, I don't see Carrie. I see Thomas, I see Allison, hi. Hi, Ann.
Allison.
Hi,
How are you?
I'm doing good.
Good. Is Carrie coming on with you or?
The last I saw her, she was thick in a meeting and it didn't, I hope they'll be done before midnight.
You mean there? You mean there?
Carrie, yeah,
Carrie, yeah, I got you. Okay. All right. Well, anyway, thank you all for coming. Madam Secretary, do we have a quorum?
We have a quorum, Madam
Okay,
Chair.
let's stand and say the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which stands one nation under God, indivisible, with liberty and justice for all. And you're going to do the invocation?
Father, I thank you for this day and I thank you for this opportunity to meet. And I just pray that I just ask you for wisdom as we do the hospital business and just really ask for clarity, wisdom, and kindness to one another. Thank you for that. It's in your name we pray. Amen.
Amen.
Man.
Thank you so much. Okay, do we have any visitors' comments? I don't think there's any department updates other than what we're gonna do, so I think we're good. Are there any additions or changes to the agenda? No? Okay. Can I get a motion to approve the minutes from last meeting and also all the March meeting minutes?
I'll make a motion to approve the minutes.
Leah, thank you. Second,
I'll second.
thank you. All in favor?
Aye.
Opposed? Okay, that's approved. Okay. Randy, would you like to do the introduction?
Yes. Like to introduce Karen Paul as our interim chief human resource officer. She can give a little bit of information about her background, what she's been doing the last few weeks and the processes she's put in place. So welcome, Ms. Karen Paul.
Good.
It's so nice to join all of you. I really appreciate being here and I haven't been here very long. I've gotten to know some of you, but those of you that I haven't yet, please just tap me on the shoulder. Let's get some time. I'd love to get to know you better as well. So please do that. I'm not with you forever, but I am with you for a chunk of time, Randy. And I really am looking forward to making some differences with that time that I'm here and working very closely with you as we move things forward. So thanks for having me.
Thank you.
Nice to meet you.
Coming.
Thank you.
Welcome, welcome, welcome. That's awesome. Okay, let's start in with strategic initiatives and Randy finances.
Yes, under finances, I'll just go over a little bit where we're at with the audit and some additional information with Durbin and Associates. So Durbin and Associates was authorized to come in and do a financial assessment. They did not get all the information they needed. So they will be here on April 29th to gather all the pertinent information that they need from Sandy and Jennifer and other departments to finish their financial assessment. Then they'll move forward with that to get it, prepare it for the board, hopefully about a week after that. And then they'll be finishing up on some additional items from a finance perspective. That's some other information that we couldn't gather pertaining to the audit, and they will present that to the auditors as well, working with Daniel and his team. So the audit was potentially to be March to the board of directors, and now hopefully it will be May, but if they don't get all the information, it will be June. But I feel very confident with Durbin and Associates on it. They will have all the information they need to present the audit in May to the board of directors.
So just for clarity, you say they are coming April 29th, you mean Durbin?
Durbin
Not
is coming,
Casey.
right? Durbin, Casey Peterson is not coming. Durbin and Associates will be here on site August 29th.
April 29th.
April 29th.
Mhm.
Yeah. Okay. Are you okay for Jen to go next?
I'm okay for Jennifer to present.
Okay. I don't have to stand.
No.
Okay, so for our income, for our operating receipts, we received $2,548,942. Our retail pharmacy is $355,000, $355,050.50. Our merchant account is $114,255.33. Our money market interest is $15,534.81. Our Avidify is $15,725.12. Our Harry Ackley Memorial Interest was $2.79. And our operating disbursements was $96.30, and that was for interest. You will notice that in February where you see the $29,910.02, and you look at it, that is our Lincoln retirement. So remember when I told you guys that it was put back in our bank account and then we had to redistribute it, so that's the reason why you see such a big difference there. Our operating expenses, it was $2,311,125.93.
And that does include payroll, right?
Yes, it includes payroll, but it is up because we do have more expenses at this time. So our hospital district, the pharmacy for the Cardinal was $84,423.78. Our retail pharmacy ACHs were $355,206.40. Our merchant fees were $3,634.72. Our Avidify was $5,849.74. Our total monthly expenses were $2,760,240.57. And for the Avidify and the care credit, so when you see those fees, what you look at is if you go up to the top and you see the income, you would take that income and that expense and add it together, and that's what we really brought in. But then, of course, that's what the fee is. So if that's what you wanted to know the difference, that's how you could find the difference in there. Our outstanding AP checks were $201,749.12. So our total income after expenses, we have $87,617.26, which if you look for the month before, there's a big difference there. So it's nice to not be in the red. As far as the changes that are going on in my office in the accounting, I do have a little gal named Kaylee that she's been helping me. I've been training her on how to distribute the AP invoices, key in invoices, and do some little things for me, which is nice because we have Sage and ADP and all of the other implementations that we're gonna have. So I'm very thankful that after a long time, I have somebody that's helping me. So I really appreciate it.
She seems
Yeah.
really nice.
She's very good. And she pays attention to detail, so.
And what is she gonna be helping you with?
So she's helping me with distributing the AP invoices and keying in invoices.
Okay.
Or little things that she, while she's doing registration, she can come in and say, hey, you have something for me to do, and I can give her something. So it's really nice to, take some off my plate so I can add some more.
So
That's refreshing.
you're still doing payroll there?
Oh, yeah,
Yeah.
yes, most definitely.
Well, and I might want to add to the finances, and I want to commend and give credit where credit is due. Since I've been here since November 24th, I think with board's approval, but also with all the departments and their managers, but also with Sandy and also Jennifer and the finance team and everybody involved here at the organization, we've been able to put back $2.5 million in the money market. Plus that money market is $160,000 in interest. So I want to give credit where credit is due on that. And they continue to watch spending and everything else. So I think it's very important that we give credit where credit is due. So thank everybody for the hard work and dedication.
Yeah, we put all the money back. So we only took $200,000 out since you've been here.
Yep.
And we put the 200,000 back, so we really haven't touched it, so. we Look at it like that.
The 601 of that was Medicare
Yes,
payback.
yes.
That's fantastic news.
It is good. Thank you.
Yeah,
You're welcome.
that's a short period of time. That's only 4 months.
I know, it's remarkable. Are you finished?
Okay.
Okay.
Okay,
Leanne?
am I good to go?
Yes,
thank you.
I have to go take other kids from tracks.
Okay.
Thank you so much, Jen. Leanne?
Okay, the overtime report, there was more hours, there was like, last month it was 1,117, this month it's 1,321, so there's quite about 100 hours increase.
Is there a reason for that?
I think it's because of like the business office, they had H&H, dealing with
Okay, that's
H&H
okay.
and the audit and the,
Illness and surgery and.
right, and new people and, okay. So yeah, there's a reason for it.
Sorry, I.
That's
Okay.
okay.
Almost every department.
It's almost every department.
Almost every department.
Yeah.
Yeah. The Epic AR, the AR days are up, are down from last month, 2.1 days to 57.60. When I came on board, it was like 90
Yeah.
days.
Yeah,
So they've come down a lot.
yeah.
They're doing a great job. Utilization review, pretty much everything's pretty much the same. Patient days, hospital admits. Really, there's not much. She didn't feel like there was much change in those, did she?
No.
Okay, so if you want to look at this, it's on your,
We have some, we had some.
do we have
Here.
some out here?
Yep,
Okay,
there you go.
He did mention that there was 42, there will be 42 new manor, or, you know, the census in the manor is 42, or would be today, or something like that.
Right, they increased from 38 just a month ago. Is that right, Kim?
We're
That's
at,
pretty right?
the other day in Quality, we're at 41. I think they did end at one.
I think, yeah, it changes very quickly. Okay, I see, when we had a report yesterday, or on Tuesday, Manor had 42, and, acute care had 4, and skilled was 2. And then she just told you about the cash position, overtime report, we did that. Self-pay continues to rise. The 340B reports looked good. We captured about 11K for the month.
For the, what you call, what is it called, Kim?
Prolia,
Prolia, yeah. They couldn't capture Prolia before, but we captured it this month and it was 11,000, so.
I think that's about it.
I don't think it wasn't that they weren't capturing it, I think it just wasn't showing up on the report, wasn't that?
Well, they just said they couldn't capture it and they figured out how to do it, I think, so. Could've been.
I had understood that they just couldn't get on the report.
No, I was just listening.
Guys, we just need somebody on mute, please.
Are you gonna talk about the hospital projects, Randy?
Yeah, down the road,
Okay.
yeah.
Discuss them.
Yeah, that's great.
Okay. Okay, so, Holly, Kim? Yes, so no med staff credentialing this month. So moving on to med staff. Pharmacy, we touched on back orders. The racemic epi was still in back order, but Joy said we should be getting some more this month. Otherwise, we're keeping ahead of all of the back orders. She brought a couple of formulary medications to med staff. One of them was Andexa, keeping it on consignment, which is a reversal agent for Eliquis and Xarelto, which are blood thinning medications. So we don't get charged for the medication from Monument Health until we actually dispense it and use it. So just keeping it the same like that. And then Anavip, so just increasing the amount on hand. And the Anavip is the antivenom that they use, they keep on hand for rattlesnake bites and stuff like that. So I'm just kind of increasing the amount that we've got on hand. Radiology, she'll probably touch on it more later, but the x-ray machine is coming in the room. June 3rd delivery date, but I won't give too much away. She can talk about that. Lab, we just discussed, so waived testing for
strep throat testing, PCR testing over at the clinic, it's gotta be waived, because we don't have the proper CLIA certificate over at the hospital to do non-waive testing, so we need to waive testing. So we're looking at machines for that. At the time, the nursing home report, there was 38 census. They were gonna admit 2 new residents over the next couple weeks, so we are up to 41 as of, I believe, yesterday morning, at 21. Allison Perla is gonna be starting June 3rd in home health, so get Heather some help in there. But Carmen's still filling in until Allison starts. Chuck talked about trauma board back removal. We're having a trauma survey come up here next month, so we were just kind of reviewing things before the survey, and that was one thing we wanted to talk about was the trauma backboard removal and removing it within 20 minutes. And that's it for med staff. Jump over to quality. We had 25 incidents in March, and they were all fairly benign incidents. Patient satisfaction surveys, we had 1,009 of them sent out with a 14.57 return rate.
Sounds so good, huh?
Not the greatest, but when I talked to, I had a call last Tuesday with my consultant lady with Feed Trail, and I said, I don't know if we're catching urgent care visits, because I told her, I said my son was seen in the urgent care, and I never got a survey for that. So she was gonna look into it. They found that there was a 404 error coming over, and so we weren't capturing
Okay.
those urgent care visits, so you'll probably see our numbers like really skyrocket now. So just working with them to
Good call.
get all the bugs figured out. We went over the current number of temp staff, so we've got 6 CNAs in the manor and 1 RN in the acute care. So Melissa said we'll be losing 2 and gaining 1 around May 1st, so we're gonna kind of stay that status quo there.
Didn't we have an RN there too? As of the other day?
Yeah, we did.
That's what they told me.
Do we have an RN
That's
in the manor?
finances, that's what they said.
We have one in the acute.
One in acute care and one,
That's what they told us, but that's
Yeah,
okay. If it's
it's
not,
not
that's
changed.
fine.
Sure, I can double check
One
it.
last temp is okay with me.
Yeah, yeah.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
The Daisy Pedal Award, I'm not sure if you guys have seen on Facebook, but it's been out there being promoted. We got our boxes, maintenance, bless their hearts, hung up all my nomination boxes today, so those are out. When I looked yesterday, we have 2 nominations already. So, just trying to get it promoted more a little so that we can get some more nominations and get our first award out here shortly. We're gonna be doing a launch party if you guys are all free. On Nurses Day, May 6th at 2 o'clock, we're gonna do ice cream nachos. So like instead of tortilla chips, like waffle.
I'll be
chip.
there.
Yep, all the good things.
May 6th, 2.
At 2 o'clock, yep, in the dining room, so we're gonna do like a launch for both like the pedal
Okay.
and invite like all the staff and everybody to just kind of have a party about it. In the manor, our 5-star quality rating, we did have 5 transfers to the ER. 3 of them did come back to the manor, 2 on the same resident, she went over twice and came back. And then 2 were transferred for a higher level of care. Still no patients, residents on any anticoagulants that need constant monitoring, but we're gonna have to admit them looking for that. Opioid stewardship, We just had one issue that we looked at. One of the nurses had updated the narcotic ordering sheet to update with the new residents. And the medicine has to match exactly what pharmacy has. And they did like the brand name versus the generic name, and it has to match. So we fixed that portion of it, so it all looks good. We talked about safety, resident safety concerns, using when to use like the sit-to-stand lift that helps them stand versus the Hoyer lift, which is a complete lift. Making sure that the residents, if they can't stand on their own, are being safe and using that full body Hoyer lift. No new COVID in the manor, but in all that did say that there was some uptick in UTI, so she went and did some education with the staff on top of care. And then she said our antibiotic usage overall facility-wide was low this last month. Our ED wait times, our arrival to discharge and our arrival to transfer times were up, but our arrival decision to transfer time was down. So our providers are making that decision right away that they need to transfer their patient out, but we're still seeing an increase of wait time before they actually leave the door, because the providers, the accepting providers, like, well, before you send them, can you do this, this, and this before they come? And then when I was doing my chart review, monument has been on diversion again, so they were trying to find some placement for some of those patients as well.
Is it because of COVID?
I don't know what the diversion is, so it's not. And then home health, Heather said everything's going good with her med rec and her senior oversight. She's been double checking the med rec, and that they've had a situation that calls for it, or anything in the hospital, or anything like that. The clinic survey return rate was at 18.06, but like I said, that's probably going to increase now that we're capturing the visits. Pharmacy Joy's been working on the formulary. She's been working on getting the QS1 interface, so that's her pharmacy interface with Point Click Care, which is the electronic health record at the manor, to talk to each other so we can start that scanning capability of the medications and hopefully add that one extra level of patient safety over there. And then we discussed the Talis machine being kind of light, and it's just kind of vomiting pills. I guess I don't know what it's just dropping multiple different pills that it shouldn't be dropping, and kind of clogging up the system, or crushing pills when it shouldn't be, or mislabeling them. So I was actually in there today and watching kind of Donna run her process, and she has to sit there and babysit it. Like, she can't even walk away. She has to like sit there and watch it and babysit it. So those are just kind of some areas that we're seeing there. And then in HR, we talked about some payroll errors, and just a couple this month, but they were fixed corrected in a timely manner. And then she's also been looking at employee files to make sure they're accurate. The benefits look good, education is good, everything's up to date. And that's about it for me.
Fantastic. Jamie, Clark, covered everything. You covered everything. Good.
No, I was gonna say, Melissa wanted that on the agenda, I think sometime maybe next month for that machine, the civilian life.
The cows?
Yeah.
Yes,
Yeah.
packaging machine. Yeah, yes, we can do that next month, because we're still looking for bids.
So, yeah.
Talus, T-A-Y-L.
T-A-L-Y-S-T.
T-A-L-Y-S-T. Yeah, it's in the discussions and
It seems like we talked about it.
it's in capital budget, but we're looking for bids, I think, is it?
Yeah, we're looking at some other options
Yeah.
that would be presented in the.
It was very expensive.
Very expensive,
It
but
is very expensive.
Randy had said that, in finance, that there's a lot of critical access hospitals that have closed, and we might have an opportunity to grab one there. So,
One thing I did also forget to mention, I don't know why I keep forgetting to mention it, a brag point. We won another quality award for Yellowstone this year. So
yay.
I'll do my presentation at our annual meeting in June and bring home some, as we call it in the sports world, bring home some hardware.
very nice,
Very good.
congratulations. So Jamie, are you through?
I'm through.
Okay. Nick, you have anything to add, right?
No, I was just gonna mention the Taos machine.
Taos,
Yeah. Because there's been some issues with that machine that we've been talking about already in the last couple months. So I was just gonna say that, just where are we at with that machine?
Yeah, and that goes hand in hand with the lab and analyzer too. Those two things are being looked at when.
I was gonna say too, in that quality meeting, this is kind of just a comment. I really liked how the meeting went. I thought it was very productive, and I thought I learned a lot from you guys. You guys are just kind of going back and forth talking as a department, so just sharing that. I learned a lot in that meeting yesterday, so thank you for that. So it's very professional.
Awesome. Awesome. Okay, Keisha, radiology update, old business?
Yeah, so we're just moving along with our project. Ron has quotes and we submitted everything for flooring, electrical. Our goal is basically to have everything construction-wise on standby downstairs, ready to go and staged. We're looking at the old system being removed the week of May 6th. It'll be a two-day deinstall. And then we're going to transition to just using our portable machine for everything. Which is, we're gonna get through it. Other hospitals have done it, we can do it. I've updated all the med staff on this as well. And then we're looking at a delivery date of June 6th, tentatively. I'm hoping, I have a meeting tomorrow with Phillips just to kind of go over everything and see where we're at with the machine and manufacturing and everything. So if we need to push it back, we have time, we have wiggle room to still have that deadline of it being installed, us being trained before rally goes around. So we're looking good, we have everything kind of just on standby. Ron's been on top of it with flooring, and we finally waited to go with a company out of Gillette. So, because our other company in town wouldn't get back to us. So, but yeah, we're doing good. We're excited.
What color is it gonna be?
The machine?
No, the room.
I don't know yet, because the machine has like a lime green
That's
color.
a surprise.
So,
Yeah.
yeah.
Color coordinated, lime green.
Well, yeah, so having a lime green machine's a little,
That's a little
I'm
tech.
green.
yep, that's Phillips for you.
Lime
Well,
green.
thank you.
We could go
But we're
purple.
excited, so it's nice to know that other facilities are putting it in as well, so we'll be pretty competitive and right there with them.
See what color the rooms are.
Yeah, I do have ins at all the facilities, so.
Orange.
Yeah.
Thank you very much. Okay, Randy, medical staff update?
Yeah, so we're still looking at 4 specialists from Campbell County. But also tonight here, I had Dr. Dan Baca and his partner, Jeremy Dave, Dr. Dave, I don't know if he's on the
Actually,
line.
Scott Rigdon is calling in, he's the guy.
Okay,
my
Scott,
partner in cover
okay.
here. Yeah.
Okay.
And I think he's on the phone there, but yeah.
Okay, good. So you guys can kind of speak what you can offer to the community, and then they're going to be at the next medical staff meeting next week, also on the Zoom doing a presentation as well. So
Scott, are you up there?
Let's see, what's his iPhone?
Yes, I'm here. I just was on mute. I'm here.
Oh, there he is. Okay,
Can you guys hear me okay?
yeah, a little bit louder.
a little bit louder.
Okay, great. I'm driving home from my rural clinic and my son has a minute in a track meet, so normally I pull over, but I'm trying to make it to the high jump, so sorry.
We get it, we get it.
It's a pretty cloud view.
You guys have any direct questions?
No, you can just tell us about yourself.
Yeah, I don't think you heard that part, sorry.
That's okay.
Sure, okay. You want to go first, Danny? You want me to start?
You can go ahead, and
Don't be shy.
Okay, great. All right, I'm Scott Rigdon, and we work, rural health management is our, entity that we work through. And our goal is we work with smaller rural hospitals to set up non-surgical pain management services so we can effectively serve patients within their communities. We work in some larger facilities that are regional referral facilities, and we get extremely booked out, and it's difficult oftentimes for chronic pain management patients to travel for interventions and evaluations. And simply financially, as well as a lot of people that are in pain, we can't sit in a car for 90 minutes each way to actually get an appropriate evaluation and get treatment. So our goal is to work with a lot of critical access facilities being set up turnkey. We can consult every piece of it from prior authorization. We've been working with equipment, that sort of thing that we may need, that you may already have in service. And then effectively how we manage the patients and work them through the process to consulting with, I would say consulting, but interacting with your providers and your regional providers to let them know that the service is there and how we do things and high quality coordination with all the referral providers. So that's, in a nutshell, that's how we like to run our company. With respect to services, I jokingly say, if you can see it with imaging, we do the procedure. There isn't anything that we don't do with respect to interventional pain management. Everything from simple workups for surgery to epidural steroid injections, radio frequency ablations, complete joint work. If you have, in some community, service, extrafracture depression, a condition called complex regional pain syndrome, or CRPS, and PTSD is the primary use for that. We do Botox for chronic migraine headaches and spasm, low stroke. Pretty much anything that is in that wheelhouse will do those things. So that's kind of how we do things.
Yes, there's a lot to it, so we just love the offer.
You're up.
Okay, well, I'm Dan Fuchs, by the way, so, Scott is my
Last
partner,
name
that
again, I'm sorry.
Fuchs is the way, but it's pronounced a lot of ways, F-U-X-A.
F-U-X-A. Oh,
I wish I
that's-
just brought my badge in here, so. But I live in Spearfish, South Dakota, and I've been doing anesthesia up there for 10 years or so, but this is something that I've been working on since school, and Scott, I met him years and years ago, and since 2021, trained with him, and there's just working out there is a little too far from my family, and it's something that this pain management is something that I really enjoyed, so started reaching out to expand services and kind of transition out of the anesthesia that you do at typical hospital care, so that's where I'm at in my practice here, and things are all ramped up and ready to go, so we're, I would be your guy that's here on a daily basis or weekly basis, that type of thing, and Scott's my partner to cover when there's something super complex that needs to be covered that I haven't seen or done yet or something like that, and otherwise, when I'm on vacation, not hunting with him or something, so. Yeah.
Thank you very much.
Yeah.
Excellent.
Yes,
Any
thank you guys
questions
for having
for
us.
Scott or Dan?
Well, you work something side by us for it.
Yes, yeah.
So is there any type of like radiology type things that maybe we don't have here, like C-arms, those types of things that you guys are gonna need for any type of injection where you're seeing that live picture to make sure that we need to provide or look at for pain management type procedures?
Yeah, C-arm is definitely, that's something we would have to absolutely use for fluoroscopy for that. There's a couple other small pieces of equipment like for the ablations and machine there, and typically those things pay for themselves pretty darn quickly just with the actual bundle charges. So just having a C-arm is like a number one setup there, and then I'm assuming you guys have some ultrasound for point of care type of procedures probably, or.
Well, we're limited.
Sure.
What are you looking for? I mean, and would you want a big C or a mini C?
A big is ideal.
Preferable?
You get in these lumbar
Fine.
procedures, yeah, you just have to have sterile fields and things like that, so,
Right.
yeah, we
Okay.
need that type of thing.
What are you looking for ultrasound?
In ultrasound, honestly, we use portable, sometimes do that we brought, that type of
Okay.
thing, so it's not,
So like a butterfly or something like that?
so it doesn't take a whole lot,
Okay.
honestly, that's
Okay.
pretty simple, but most of the work is done with, fluoroscopy,
Right.
that type of thing, and that's
Okay.
typically where we capture the
You
billing.
don't
and
have
all
a
that.
fluoro we don't have a C-arm either,
Sure,
just to let you know.
Yeah.
And then the new X-ray doesn't have that capability either, but,
sure,
I mean, I've worked with GE fluoro before and C-arms, alarms and all that, so we could definitely talk about.
sure. Yeah, Randy and I kind of looked around and
Yeah,
talked about that equipment.
C-arms, I've looked at refurbishment, they're
Mhm.
fairly cheap, so.
Yeah, and Scott, they're very good at like sourcing out too. It sounds like you guys are looking for your products pretty frequently.
Yeah.
Know where to look, so
Yeah.
yeah, it can definitely help guide you in that direction too, but yeah.
And then some recovery then too, right?
What's that?
Recovery after the procedures?
Yes, absolutely. So we follow up, see the patients, and it kind of gives you this full spectrum of care where, somebody that can't travel at all, like Scott said, is gonna come in here and we can, from the referral aspect, from our providers in the region, and keep them here. We see them afterwards, try to set up like initial week, every other week type of thing where you come for a day or so just to start. Then when the patients build up, that way you can see patients, do procedures on the same days, give everybody a pretty current care instead of just once a month type of thing, or, as needed. And honestly, it going part-time here soon, so I can just slip into this and take care of all the needs people would have, that type of thing. So, there's a lot of opening there in time that we can cover anything we need. Just basically, just the practice builds, go with that, so.
Sounds good.
Yeah.
Appreciate
How
it.
soon? Really, it's, Scott will tell you, he sees more than 3 to 6 months is what, yeah. Everyone's different on how quick we can all get things set up, but it can be essentially as soon as, the hospital gets everything done, work credential, and those things are set, so. Yeah, absolutely.
Well, thank you very much for
Yes, thank
coming.
you for
Thank
having
you,
us.
Scott.
Good to see you again.
Nice
Yeah.
to meet you.
Yeah, no problem. Reach out if you guys have any questions.
Thanks, Scott.
Okay.
Okay, have a great night.
Thank you, you too.
Thank you.
And it would have been interesting to see how many votes may have changed because of Gordon's actions, because of the response of their communities after those bills were passed, specifically the gun-free zone bill. I think that we would have very much seen a change in votes on that one. I think you would have seen more nay votes on that than you had before.
So you're saying that that some folks were counting on the governor veto in that one?
I very much 100% think that especially school districts, courthouses, places like that were banking that the governor was going to go, no way are we letting guns in these areas. And I think that their response afterwards may or may not have swayed some of those representatives and senators to vote a different way because the response was strong.
The next thing is for the WCHD election canvas board, we need to do a quick vote update because Janice, do you want to speak to it?
Excuse me. So since Jamie is running as secretary, she needs to appoint someone to be on the canvas board, and she appointed Nick, and he's not able to be on the canvas board, so we need to appoint someone else. And Anne has said she would do that, right? So
Yeah.
you good with that,
I can do
Anne? Okay.
Yeah.
So can I please have a motion to approve Ann to replace Nick for the canvas board?
I'll move.
Thank you. May I have a second?
Second.
Thank you. All in favor?
Aye.
Opposed?
Aye.
Okay, good. That's good. Social media policy?
Yes, the social media policy has went out and a lot have been signed in return, so, expecting, close to 100% return on those, so everything's going good.
Okay. Next is the public records policy. I resent it to everyone again. It wasn't the final copy with the typo changes and whatever, but does anybody have any questions about it before we vote for acceptance of the policy?
I'm just wondering about the cost. Is that gonna be enough fee for the copying and whatnot? Is that gonna be enough to cover the cost?
I think so.
Allison? Did you hear Leanne's question?
Yeah, I heard. So, that's up to the organization. The large cost really is not the copying. It's if you end up in a search of email records or an online database, that's where it gets to be really expensive. And then you have to pass through the attorney's fees for reviewing and redacting documents, or responding with, limitation of records. So, you could revisit the copy fees. I upped them a little bit from what you had in your policy. Just because I figured you probably hadn't looked at it since inflation had skyrocketed. But I am not concerned about that amount. I'm more concerned about protecting the organization from what I would consider to be overly broad requests that are very expensive to respond to.
Is that addressed in the policy then, or those costs?
It is, you provide an estimate to them of what that
Okay.
costs, and they can decide whether they want to pursue the search or not, based on that past year
Gotcha.
cost.
Gotcha, okay.
Okay.
So, can I say one little thing? The address that was provided in there, we already had one. So that address has been updated on the final copy. I don't think it's on here, but it should be, public records request at wchs@wy.org.
Thank you. So can I have a motion to approve the public records policy? May I have a second?
I'll second.
Any discussion, further discussion? All in favor?
Aye.
Opposed?
Aye.
Okay, so passed. Thank you. Okay. Governance Committee, we're gonna go into other reports.
Okay, they guys met yesterday, I didn't show, and so they worked on the board, what did you call that?
We put together very simple documents for a very simple first look orientation kind of thing. And I'll show them to everybody when we go into the president communication, so.
Okay, so other than that, I
That's
don't have.
basically all we did. Yeah. Okay, Foundation Board. Randy, you want to speak to that?
Yeah, I'll speak on that. The last foundation meeting, I think it was Keisha and I were the only people from the hospital that had met with the foundation board. So the foundation board, we had asked prior to that meeting, wheelchairs, and if they would help fund wheelchairs. If we bought one, they would buy one. So at the last meeting, it was decided, it wasn't voted on, they didn't have a quorum, that they would no longer support purchasing any equipment for the organization, but they would support only scholarships for people that was submitted to them from the community. And that was pretty much it as far as the foundation board.
And they want to change the meeting structure, the meeting?
So they would change the meeting at the times we meet. We usually meet on every month, but it was decided that they would call the meetings, and they really didn't know when the next meeting would be. The next meeting would be is when I would notify them if there was scholarship money that needed to be brought forth from the foundation, and that was it.
What do the bylaws say that they meet?
I'm not sure. I think they were monthly.
It's monthly,
That's what I thought, it was monthly.
right. Well, they want to change the rules, so.
But like I said, Keisha and I were there, so, but nothing could be voted on. There was not a quorum.
Any questions?
And we can say something.
Go ahead. Ann?
Yeah, I don't know what I was saying. It's not important.
Well,
I was just thinking about the bylaws and the, they have their own set of bylaws.
Right. Albeit old, but yes, they do.
And then
Yeah, mostly I just forgot I wasn't on mute and was talking out loud.
That's
That's all
okay.
right.
That's okay.
So then, it was brought up from the auditors as well, through our auditor Zoom meetings, that was the board okay moving forward with the foundation audit, because history, they have always done the foundation audit when they did the hospital audit. So was the board okay moving forward with the foundation audit at the same time as the hospital audit? And I just need to, refer that back to the auditors.
Okay, President Communication, the first thing I want to say is that I felt that the decision of the foundation board not to support wheelchairs was a little disappointing to me. I think, changing the meeting and changing the focus, I think it needs to be addressed with the new board, because we do oversee that board as well, and I think that we need to relook at what the purpose is and how it should look. So that's my comment on that. The other thing is that I just want to take a quick vote on this because it's really simple. What we put in this folder, we made 5 copies of these folders. This is the orientation papers we put together with governance.
Oh, for governance.
One is the hospital district, health services. It's an orientation paper that was in there, but it just says things like facility information, tour of the facility, members of the board information, the bylaws, the board meeting information, who runs the departments, kind of, and just really simple stuff. Because the thought was that, when we have new folks come in, that probably within a 2-week time frame, those folks should be able to have simple rules and regulations, a tour of the hospital, meet the CEO, tour around the hospital, and then focus on, I know H&H has some good information for us about, different board structure, board orientation and training and board retreats and things, and that's something we could get into later. Being that the board at the time, the new board decides that's okay, kind of thing. So this was just put together for convenience, so they had something when they got here. The other paper is just the Article 4 about public meetings, to explain what public meetings are. The next copy is the board training tool that we all approved. And then the last thing in here are the slides from, oh no, I lied. Then it's a copy of the bylaws. And then it's a copy of the AHA slides that kind of are repetitive information to the documents that we put together, but we did approve both of them, so we put them both in. And that's as simple as it is. And if the new board doesn't want to use this for orientation, I'm okay with that. I just wanted, the governance committee just wanted you to have something in a pinch if you don't decide, if you don't decide to.
Who is going to be doing the onboarding?
We don't know. That's the new board's decision.
Do you usually do that?
No,
You don't?
no.
The CEO used to, but I think that's something we can talk with the new board about is,
The new board usually appoints someone.
yeah, it's usually the chair and probably another person. And then anybody else that wants to volunteer or help, depending on time, their time availability, so.
I think
Somebody raised their hand?
Maureen and
Oh, no.
Allison did that one time for us.
Well, when I came on board, Maureen gave me like 15 minutes and I was
Well,
like,
me too.
so, but I want the new board.
So historically, we have done some training for the board. I
Right.
think that the CEO was the one who provided the forms, but
Right.
I think it would be helpful if the board chair did it, maybe with the CEO present,
Right.
if possible, and then had some training with legal counsel
Mhm,
and
mhm.
probably compliance.
Right, because you do have to sign the confidentiality form and the conflict of interest. That's what it was, right, Allison? Conflict of interest?
It's not a confidentiality form, it's just a form that outlines the statutory requirements that apply to the job.
Right. So there's other documents to use, there's other documents that Allison had sent for suggestions, there's a whole bunch of things that the new board can do. The whole purpose of this is just to have something in hand when the new board starts, simple rules and regulations, so.
Well, and a lot of it was conflict of interest form and the education piece that we worked on together.
Right.
In 2022.
Right. So I didn't put any of that in here. We can, the new board can figure out, when that'll happen and how it'll happen. So can I just have a quick vote on approval just to have this available for the new board and with the content, which is very simple as I discussed? I have a
Carrie
motion.
has a hand up.
Okay, Carrie, yeah?
Obviously Ann and I are not there, and we did not see any of this material. I know it's what you just said, but without seeing it, I'm not comfortable on voting on anything that I can't see and haven't been provided with in advance. And I do appreciate your efforts, and I think it's wonderful that governance put some stuff together. But I think that you should give it to the new board, and the new board will decide what they want to do for orientation. I know when I came on board, like Allison said, the session that she did on the legal issues and stuff was very, very helpful, and perhaps we could put together something like that again. But I'm not comfortable voting on something that I haven't seen.
Well, I understand that. However, these are documents that we all voted on before. And they're also documents that are in our SharePoint drive. So it's a matter of, these documents, they're just put into a folder. So that's all I can say is that they're recently approved documents in the last couple months, except for the public meeting one, which is standard for the state, and also the bylaws, which we have. And the other two.
I'm fine, Dottie, I voiced my opinion.
I understand.
So thank you very much, and I do thank you and the governance committee for putting it together, so.
Okay,
I think Nick had his hand up.
Yeah, so we're gonna meet in 2 weeks from now.
May 2nd.
Could we do it then, table till then, and then vote on that, or is that gonna be on something?
No,
we can
it's
put on the
fine.
agenda? I'm just saying that way, at least that would give people time to look at this, and then we can make that decision then. That makes
That's
everyone
fine
more
with me.
comfortable.
Is there any other discussion?
I think that would be nicer. I personally, I know that we can go find those on our SharePoint, but I don't think, from what I can tell, they're not on today's the stuff for today, are they?
They are always in the board orientation folder that we have provided for over a year.
Okay.
They're in the board orientation folder.
I just didn't see that with the stuff for today's meeting, but I probably just missed it.
I can take the
But,
documents
It's okay.
and send
That's
it to
okay,
you.
it's okay.
It is not it's not an emergency. It's not that important to have to immediately get it approved. But just remember, May 2nd is a special meeting. So just remember that we're gonna put that on the agenda in addition to the more serious things we have to speak to. So I'm fine with that. Does anybody else?
I think Nick's idea is good.
I'm sorry, Ann?
I just think Nick's idea is a good idea. That way we can just look at it and be there in person. So sorry that we aren't there to see it.
No, that's fine. Does anybody have an objection to tabling it until the May 2nd meeting? No? Okay. That's what we'll do. Okay, the next thing is just items for the future.
No, it's resolution.
Oh, I'm sorry, we did miss that. That's another one. The resolution is a document that I'm gonna read to you that we just need to have a quick vote on, and I'll sign it. It says, whereas Weston County Health Services serves Weston County and the surrounding areas as a critical access hospital, and whereas Weston County Health Services desires to be designated as a trauma receiving facility in the Wyoming Department of Health Office of Emergency Medical Services statewide trauma system. Whereas Weston County Health Services Board of Trustees recognizes our commitment of resources to the state trauma program is necessary and valid commitment. We will continue to take an active role in coordination of appropriate agencies, professional groups, and hospitals in our area to develop a trauma response team, participate in the state database for trauma, and have an active and vital plan for increasing the quality of care for our trauma patients. We will continue to support the efforts of our trauma team with the support of a trauma coordinator. Be it therefore resolved that the Board of Trustees for Weston County Hospital District does hereby authorize the administration to apply for designation of Weston County Health Services as a trauma receiving facility, duly adopted by the Board of Trustees of Weston County Health Services on this day, 2024. And I did send this document to everybody to see. So can I get a motion?
I'll make a motion to approve the resolution for trauma receiving facility.
Okay, Jamie second. Any discussion?
I was wondering where it came, it looks good. I just was wondering kind of the history behind it, or why we were needing it, or what the story is.
To my knowledge, Piper gave this document to Denise that said that we needed to sign this as is it yearly, is it it's annual? It's annual.
They're coming to do an annual survey the first part of May, or the middle of May.
Carrie?
So are we a trauma center now?
Yes, level 4.
Okay, so this is not adding anything? This
No.
is just reaffirming what we already have?
Right.
Right.
This is a standard document that's been out. It's not been changed to my knowledge, so. Okay.
So that was the discussion.
Any more discussion? Okay, all in favor? Opposed? Okay, so passed. Thank you. Now, items for the future. April 23rd is the joint medical staffing board meeting. May 2nd and 3rd is the H&H Leadership Solutions on site. May 2nd is a special board of trustees meeting that I encourage everybody to please attend. May 7th is the special district elections. And Denise, do you want to tell the sites again? Library?
So in Newcastle, they'll be at the library. In Osage, it's the fire hall. And in Upton, it is the community center. Voting hours are from 10 a.m. to 6 p.m. If anyone is interested in getting a absentee ballot, they can get a hold of me and I'll get them an application. We're accepting absentee ballots until the end of the day, May 6th.
End of day.
Thank you, Denise. I just had a question about the joint medical staff meeting on April 23rd. What time is that?
8 a.m.
Thank you.
Uh-huh. And then May 18th, we have the WHA CEO spring meeting. Any questions about items for the future? No? Okay. Then may I have a motion to go into executive session?
I so move.
Second?
I'll second.
Okay. Discussion? All in favor?
Aye.
Okay, opposed? Okay. We will go-
Madam, just for the record, it's for the purposes set forth in the agenda.
Correct, thank you. And it is listed in the agenda for the WS 16-4-405 as stated on the agenda. So thank you all for coming.
Thank you very much.
Thank you. Nice to meet you.